Wonderful. Thank you, everyone. Good afternoon. My name is Suerie Moon. I'm a member of the Forum on Microbial Threats. It's my great honor and pleasure to be moderating this first panel of the afternoon. I lead research at the Global Health Center, which is a think tank within the Graduate Institute of Geneva, and we focus in particular on the intersection of global governance and health. The topic of this first panel of the afternoon, I think, could not be more important and more appropriate to, in fact, place first on the agenda. I think it's already been mentioned how important community and national level preparedness is. It's very much the first line of defense for any kind of outbreak of an infectious disease. And so it's very appropriate that this is where we begin our in-depth discussions this afternoon. I'm just going to open up with very, very brief remarks to frame the discussions, and then I'll invite our four panelists to join me up at the front. So first, I think it certainly has been recognized for a very long time, perhaps not 100 years, but a very long time, how important national and community level preparedness and engagement is. But this recognition was really codified, of course, when the international health regulations were revised in the aftermath of the SARS outbreak, where increasingly it became understood that national level preparedness was not only important for countries themselves, but of course also for the global community at large. And building an adequate minimum level of capacity became an international obligation and not only something that made sense at the national level. I think it's important to note also that after the Ebola crisis, one of the most significant areas where we saw a lot of momentum was, in fact, strengthening accountability between countries for this national level of preparedness through the JEE process, what could be thought of as a peer review process, to strengthen the political will and investments into building up that national capacity. I would say it's one of the most significant post-Ebola reforms. But we also know from this morning's discussion and from history that this issue of the roller coaster is very real, and that sustaining money, political attention, leadership for investing in those capacities is very, very challenging, and we've not really found an easy solution to that. So we have today on our panel four really terrific speakers. I cannot imagine actually having more appropriate speakers to share with us their experience, talking about at least three very different outbreaks in three very different country contexts, and then also looking at the global level and what global actors can do to support community and national level preparedness. I would like to invite up all four of our speakers, Dr. Suerie, Dr. Fala, Dr. Lung, Ms. McClelland, to come join me up at the front. So each of the speakers will be providing just a few minutes of opening remarks, sharing in particular their experiences of building up and strengthening community and national level capacities. And we'll have, I hope, plenty of time for back and forth engagement with the audience. So I hope that you'll be ready with your comments and your questions. And I really look forward to a back and forth engagement. Okay, terrific. So first, I'd like to introduce Dr. Suerie, who is the Assistant Deputy Minister of the Ministry of Health of Saudi Arabia, and he's also the International Health Regulations National Focal Point, and will be speaking to us about his country's experiences with MERS. Dr. Suerie.